I've been working with Falck for 5 years. I came to Falck in 2019. I've been in the IT industry for 22 years now, in various different large Danish companies that have international setup working with IT. And right now I have a responsibility of 152 colleagues internally. And then, of course, I am also the one responsible for the HCL engagement. And we work out of Europe, Latin America, and then US. So my primary responsibility, of course, to ensure that all the infrastructure services are running. And that's part of me being here we just signed a new contract for another 5 years. So we wanted to come here and meet the team, and we are very excited to be here. So one of the challenges I'm facing is that our business needs are changing, which is also reflected in the new contract with HCL. So the needs are that we need to safeguard our data. The data cannot be processed outside EU. So we need to both host and support specific healthcare systems out of EU. So we've also ensured that in a new contract with HCL that a lot of our team members will be relocating to delivery centers in Romania and in Krakow to ensure that we can comply with the rules. And of course, that also brings a competitive advantage for us because a lot of our customers are very strict about the data transfers and where the data is hosted and where the solutions are being supported. In order for me to do that, I need to build a infrastructure that gives them that benefit and comply with all the compliance and GDPR regulations that we have. And in addition, we're also building a private cloud, sovereign cloud setup, only being hosted and managed out of EU, together with HCL, in order to address the need of the business to deliver this. So I'm excited about that. It's a very important step for us to be able to do that. Especially because that's what the customer calls for, and that's what the business needs in order to deliver the services. So within the healthcare, it's also important for us to be able to ramp up fast, and we can do that with the new technologies that we are bringing into the new contract with HCL. And that's where I think HCL plays a vital role in order for us to be able to deliver that to the business. So preventive healthcare services are going to prevail and increase over time. Things like remote patient monitoring, taking care of people at home, diagnostics, and then treatments that can happen from home is going to be tremendous help to the pressure that is on the established healthcare systems around the world. Especially in European context, the healthcare system is very pressured. It's very expensive to have people hospitalized. So we want to try to capture people's sicknesses in the pre-hospitalization stage, where we can actually make a difference with our services. In the future, I foresee that people can have all kinds of gadgets to measure their blood pressure and heartbeat and sugar levels, etc., where we can help patients to capture things even faster and put in treatments even faster than we are able to do today. And at the same time, take the pressure off the established system, so the waiting and the queuing of our hospitals can concentrate more on the very vital sicknesses that we have. And that's where I think Falck brings some real value in terms of helping out with that challenge. So the specific use case we have right now, as I said, is our ability to ramp up our sites. When we win a new contract, we have to honor that, and we have to sometimes ramp up that contract within 3 months. So our ability our velocity and agility to do that very fast is super important for the business. So using new technologies like software-defined network to do the network connectivity, use cloud services, and the private cloud services are going to be a tremendous help to to do that for the business, so time to market is super important. And the technologies we are doing are super important for that. We also recently migrated our Norwegian business entity in as part of the global infrastructure, and we used the new technology that we've developed and delivered together with the HCL in order to do that faster. I think I would like to empower HCL to use the innovation muscle more. HCL has a lot of customers. They are investing a lot in innovation through the innovation labs and new technologies. And I think we need to tap into that much more than we've done before. I think we don't have to reinvent things in our context. I think we can use the knowledge that HCL is deploying and the technology they are deploying for other customers. And I think we really can truly embark on that experience and that knowledge much more than we have. I'm hoping to do that, and also I'm hoping that HCL can take more care of other areas other than the infrastructure outsourcing. And we, application maintenance is an area we really look forward to look into together with HCL. At the same time, we also, within the data space and data science space, I think we can do something together in other areas where I think HCL can play a vital role in us being able to achieve the results that our board and our stakeholders and our owners actually looking for us.